Hi, I'm Steve Van Meter, Certified Financial Planner, and this is my 2021 Ultimate Guide to Medicare Benefits. In this class, you will learn what it is and what it covers, how and when to enroll, how much it costs, and what supplemental insurance options there are. What is Medicare? It's a government-run health insurance program for those 65 years and older. It's administered by the Centers for Medicare and Medicaid Services. Now, when you look at your health insurance before 65, you will either be covered from an employer group health insurance plan, a retiree health insurance plan, COBRA benefits, the Affordable Care Act, or an individual policy, or through the Veterans Administration. Your health insurance after 65, Medicare pays first and your other insurance pays second. Now, there's an exception to the rule. Employer group plans that cover 20 or more employees if you or your spouse are still working. In that case, your group coverage then is your primary insurance and Medicare will become secondary. So how do you enroll for Medicare? You contact the Social Security Administration at the toll-free number on the screen or from the Social Security website at https://www.ssa.gov/Medicare/apply. There are multiple components to Medicare. There's Part A, which covers your hospital insurance, Part B, that covers your medical insurance, Part C, that covers your Medicare Advantage plan, Part D, that covers your prescription drug coverage, and Medicare supplemental insurance. So how do you enroll? Well, if you're receiving Social Security or railroad retirement at age 65, enrolling in Medicare Parts A and B is automatic. Coverage starts the first month you turn 65, and enrolling in Parts C and D or a supplemental is not automatic. You must choose a private insurer. If you're not receiving Social Security at 65, then you'll follow these rules. If you're covered by a large group plan with more than 20 employees, you don't have to enroll. Enrolling in Part A is free and optional, but will prevent you from funding an HSA. If you're not receiving Social Security at 65, you have the 3 months before you turn 65, the month you turn 65, or the 3 months after you turn 65 to enroll. If you or your spouse plan to continue working past 65 and you are covered by a large group plan, then you qualify for the special enrollment period. Special enrollment period allows you to enroll in Medicare anytime prior to or through the 8-month period after your group coverage ends. Now, there are two types of Medicare. There's original Medicare, and then there's the Medicare Advantage plan. The original Medicare components include Part A, your hospital insurance, Part B, your medical insurance, and then you can add Part D, prescription drug coverage, and a Medicare supplement insurance or Medigap plan. The Medicare Advantage components include Part A, your hospital insurance, Part B, your medical insurance, and then most plans include Part D, prescription drug coverage, and extra benefits. Let's take a look at Part A, which covers your hospital. It covers inpatient care in a hospital, inpatient care in a skilled nursing facility, hospice care, home health care, inpatient care in a religious non-medical health care institution. It does have some out-of-pocket expenses. There's a $1,484 deductible to go into the hospital, $0 for days 1 through 60, $371 per day for days 61 through 90, and $742 a day for days 91 through 150. Your skilled nursing has a zero cost for days 1 through 20, $185.50 per day for days 21 through 100, and for your blood is zero for the first 3 pints and 80% of cost for more than 3. In terms of your Part B coverages, it includes your doctor's services, outpatient medical and surgical services, diagnostic tests, outpatient therapy, outpatient mental health services, some preventive healthcare services, and other medical services. Your costs for Part B include a monthly premium of $148.50 and an annual deductible of $203. It also has 20% of Medicare approved rate for most doctor services and 20% of the Medicare approved rate for most outpatient mental health services. And those are your out-of-pocket expenses. Now, what's not covered in Parts A and B? Most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, acupuncture, hearing aids, and exams for fitting them, long-term care, and concierge care. So what is Part D? It is an optional prescription drug coverage, and there's a penalty for not enrolling, even if you don't take any drugs. It's available to all people with Medicare, and it follows the same enrollment rules as Medicare Part B. The way you get Part D is through a Medicare prescription drug plan or a Medicare Advantage plan. Your costs for Part D include an annual deductible, a maximum of $415. The co-payments and co-insurance amounts vary by plan, as well as your monthly premium. And then there is very little cost after $6,550 per year of out-of-pocket prescription drug expenses. In terms of your supplemental options, you have Medigap plans, which are an additional health insurance policy that are designed to lower your out-of-pocket expenses. They offer more health insurance coverage than you would normally get through Parts A and B. It helps cover the gaps in original Medicare that are sold by private insurance companies, and these companies must follow federal and state laws. There are 10 standardized Medigap plans in most states that include A, B, C, D, F, G, K, L, M, and N. Costs and coverages vary by plan and by company. So how do they compare? Well, you want to look at your supplement plans to see what the Part A coinsurance and hospital costs are, the Part B coinsurance or copayments are, blood costs, Part A hospice care coinsurance or copayments, skilled nursing facility care coinsurance, Part A deductible, Part B deductible, Part B excess charge, foreign travel emergency costs. And in order to get a Medigap plan, you must have Medicare's Parts A and B. It can only cover one person, so spouses must buy a separate policy. And then you can go to any doctor, hospital, or provider that accepts Medicare. You cannot have a Medigap and an Advantage plan at the same time. Now let's take a look at the Medicare Advantage plan. It includes Part A, your hospital insurance, Part B, medical insurance, Part C, Medicare Advantage plan, and Part D, prescription drug coverage. So what is Part C? Well, it's part of the Medicare program and it ensures Medicare rights and protections. It's run by private companies, and you will find these different plans offered by health maintenance organizations, preferred provider organizations, private fee-for-service, special needs plans, HMO point of service, and medical savings accounts. So what is Part C? It qualifies you for regular Medicare covered services, but you may get extra benefits from the provider, which may include vision, hearing, dental, and other unique services. The way you enroll for Medicare Advantage is you first must enroll in Parts A and B and live in the plan's service area. And you must enroll when first eligible for Medicare. The most common type of plans are health maintenance organization or HMOs. The co-payment amounts are set by the plan. You must use network doctors and hospitals. You must choose a primary care doctor. And in most cases, prescription drug coverage is included, and you do need a referral to see a specialist. The other most common way you'll get a Medicare Advantage plan is through a preferred provider organization or PPO. The co-payment amounts are set by the plan. You can go to any doctor, healthcare professional, or hospital. In most cases, prescription drug coverage is included. You do not need a primary care doctor or a referral to see a specialist. There is an open enrollment period through October 15th through December 7th each year that allows for plan changes, including Part D, your prescription drug plans, Medigap plans or supplemental, and changes are effective January 1st. For Medicare Advantage, there is an open enrollment period between January 1st and March 31st. If you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan or switch back to original Medicare once during this time. Shopping for a plan is easy. You can use a broker. You can do it online. Do keep in mind that costs vary widely between plans and benefits vary widely between plans as well. You can get a substantial savings from shopping your plan each year. You'll need to verify that with your doctor and your prescriptions before shopping for a plan. You can shop for Part D drug plans and Medicare Advantage plans from the Medicare website at http://www.medicare.gov/find-a-plan, and you can shop for Medicare or Medigap plans at http://www.medicare.gov/Medigap. If you need assistance shopping for a plan, you can use the State Health Insurance Assistance Program, or SHIP. It's available in all 50 states. It provides free and objective information regarding appeals, buying other insurance, choosing a health plan, buying a Medigap policy, and Medicare rights and protections. So as we wrap up this section, plan to bridge to Medicare if you're retiring before 65. You may wish to consider a Medicare or Advantage plan. Be sure to shop your plans annually, and don't hesitate to reach out to SHIP if you need some help. And be sure to check out my website for a complete online resource, a fully downloadable guide in PDF, and a podcast for this class. Thanks for watching. The content of this video is provided as educational information only and is not intended to provide investment or other advice. This material is not to be construed as a recommendation or solicitation to buy or sell any security, financial product, instrument, or to participate in any particular trading strategy. This video was prepared by Stephen Van Meter in personal capacity. The opinions expressed in this video are that of my own and do not reflect the view of Atlas Financial Advisors Inc. or Stephen Van Meter Financial.